Hey there, I'm Dr. Chris Rayo of Unison Pro Youth Institute. We're located in wonderful West Palm Beach. You can see the background there with the wonderful water view and view of the ocean maybe. Anyway, today's topic is a review of a blog, December 9th, 2023. Is Bio-HRT safe and effective in women? We'll also talk about men as well. And Bio-HRT, first of all, that stands for Biologically Hormonal Replacement Therapy. Again, this is from the blog, December 9th, 2023. Welcome back. So we had part one covered before. This will be part two. So welcome back to our Bio-HRT series, diving into the world of hormonal optimization for men and women. The previous blog we had discussed HGH, DHEA, and aging hormones like cortisol and insulin. So as we age, the hormones you wish would go up, go down, and the one you wish that would go down, they go up. The aging hormones, insulin and cortisol, tend to go up. This increases your risk for the apple shape, the visceral adiposity that most guys get. Postmenopausal women will switch from that pear-shaped, the gynecoid shape, it's called, to the android shape, more the apple-shaped with the visceral adiposity, the abdominal fat, and skinny legs and such. So it is true that as couples age, they may start to look similar from that. So anyway, not just important to replace the ones that go down, to optimize those to the age-related optimal levels, but to lower insulin and cortisol. And most of the time that's through lifestyle. No sense to just optimize one without the other ones. As we've mentioned before in previous blogs, the hormones are like the players in an orchestra. They all have to know their piece, the right song, the tempo, the volume, and to play off of each other. Just to pick one or two and to megadose those will cause you more harm than good, and can actually cause you problems, as we've said, as opposed to optimizing your health. So very crucial to optimize all of the hormones, to lower the ones that age us and to optimize the ones or to replace the ones that diminish as we age, to keep that body composition right? As we age, we lose muscle mass and bone mass at about 1% per year. We lose the good weight, we gain a good weight, so we tend to gain fat, unless you're proactive about it. And what you'll find is that you may be trying to improve your lifestyle more than ever with the diet, exercise, and such, and yet you're not seeing the results of it. You need the chemical messengers, the hormones, to be optimized so that you do start to see results. So is Bio-HRT safety and effective in women? And this is from a peer-reviewed article this year from the Journal of Clinical Endocrinology. So I'll bring to you the latest in what's safe and effective, what's proven out there, and the facts. There's so much disinformation out there. That's why I wrote the books, the Midlife Health Guide for Men and the Midlife Health Guide for Women, to show you the facts, like that old show, Dragnet. I'll be one of the facts, ma'am, right? Anyway, so midlife health for women, the Midlife Health Guide. If you get into that, it will explain a lot about the aging process, the epigenetic clock, and other things that I was discussing years before this even became on the horizon of medical care. Understanding menopause, first of all. Menopause brings upon, although its natural state, it does bring upon a host of challenges. Unwelcomed weight gain, sleep disturbances, mood swings, cognitive changes, and declining bone and muscle mass. I give the references in the blog. Early menopause correlates with heightened risk of diabetes, heart issues, and mortality. Additionally, a quarter of women experience vasomotor symptoms that can precede menopause by a decade. Vasomotor symptoms, that's the night sweats and the hot flashes that you may get. These potentially escalating heart risks and disease. So insights from this review article from Clinical Endocrinology. The facts, ma'am and women. Menopause and its aftermath are natural results of ovarian aging marked by fertility loss and a significant drop in hormone production. Kind of accept that, right? That's an easy one. Menopause symptoms with varying intensities respond well to several agents proven effective in clinical trials. They have a lot of somewhat new medications out to treat these symptoms, but when you look at the cost and the side effects, going at natural Bio-HRT to me makes the most sense because you're treating the root cause, right? And I'm going to cover that in a YouTube video entitled, to paraphrase it, Treating Depression in Menopausal Women. That's a very good one, which will be upcoming. The safest initiation of HRT is for women within a decade of menopause or under 60, without contraindications and with manageable cardiovascular and breast cancer risks. So it is very important. There's no two women the same. So it does take an individual and personal evaluation, seeing what that your risks are, a special examination, looking at your goals and risks and all of that to put together a personal plan just for you. And that's what we've done at Unison Pro Youth Institute for the past 25 years. We are the best at this in Florida's oldest anti-aging facility. We're kind of glad to be old in that regard. Continuing with the findings from this latest clinical endocrinology, continuing HRT depends on individual preferences, health status, and well-documented shared decision-making, talking between us, right? While oral HRT has been extensively studied, lower doses and transdermal therapies might offer safer alternatives with potentially fewer adverse effects. And this is something that I discussed in my books, the women's book, back in 2010, showing that the Bio-HRT, first of all, to use was biologically identical to what the body makes, and then to mimic as closely as we can the delivery system so you don't get the hepatotoxic effects with pills and such. This is mine here, so this is my take. Both the authors and I acknowledge the research gaps. There's a ping pong of findings with the Women's Health Initiative trial and such, most likely due to diverse biological changes necessitating different safe and effective options based on age, ethnicity, lifestyle, and other individual factors. The timing of HRT, the type, the dosage, and replacement methods are critical variables. For instance, younger women on HRT showed better health outcomes than those solely on conjugated estrogen experienced a 20% lower breast cancer rates over 2 decades. So it has to be an individual decision, shared decision making with the physician and with the patient. Stay tuned for our next installment on testosterone for men and women. We'll discuss the latest review. Again, I'm Dr. Chris Rayo. Thanks for watching this YouTube video. Please sign up for information at unisonproyouth.com. Visit our website, please, and you can also refer to the books, The Midlife Health Guide for Men and The Midlife Health Guide for Women. Thank you. Bye-bye.